I think it was a morning. I can't remember what I was doing. I think I was tying my shoes, and when I raised up, I just about passed out. I saw the little blinking lights. I started to sweat. That kind of triggered me to say, okay, something's wrong. So something is seriously wrong here.
Michael had had atrial fibrillation for the better part of a decade, really, and it came to attention about 6 or 7 years before he even sought me. Atrial fibrillation is the most common heart rhythm problem that we deal with. It tends to show up as people age, and it has to do with how the heart generally changes over the course of time. AFib is an irregular heartbeat, where the top chambers of the heart are quivering, not pumping blood, but just shaking. This causes the heart to beat very irregularly. Frankly, Michael was too young to have atrial fibrillation. He was only in his 50s. It was clearly affecting his quality of life. It was getting in the way of him enjoying what he did for a living.
I run camera for sporting events. With all the hours that we work, I started using the 5 hours, the energy drinks, to get up for the games, just to stay focused. And used those for about a year and a half. And it got to a point where I started going into palpitations. My heart was racing, a little shortness of breath, and it continuously got worse. I went to a hospital here in town. We had one of the cardioversions to try and kickstart my heart back into regular heartbeat.
And he went through the standard treatments of trying medicines and undergoing cardioversions. And he underwent a catheter ablation, and at the time that he came to me, he had been through all of the standard treatments. He really took this to heart, and I think he really took my advice seriously.
When you realize that you are in AFib, you are in tune to how it feels. All of a sudden, I would feel it kick in. The cardioversion would work for about 5 weeks to maybe 2 months. Being in AFib for so long, that is why I was having a problem getting out of it.
We talk about a personalized treatment plan because AFib is different for each patient. The way that we have approached ablating atrial fibrillation, the procedure of AFib ablation, has largely focused on the common areas of the heart that typically drive AFib in most patients. That's not a very tailored way to go about treating. So here at Washington University, roughly 10 years ago when I started, I joined the lab of my research mentor, Dr. Yoram Rudy, and he had created and spent his entire life validating this vest. And this vest would allow you to non-invasively see where the arrhythmias are coming from in a single beat. So a patient wears a vest, we wait for the arrhythmia, we're able to capture the initiation of that arrhythmia, and we know exactly where the arrhythmia is coming from. Washington University Barnes-Jewish Hospital is one of a dozen centers across the United States that has access to this system where a patient wears a vest of electrodes on the front and back.
Dr. Cuculich explained the technique that he was going to use and the vest in a way that I could understand. Not being a heart specialist myself, I didn't understand a lot of the other physicians of the process that they were going to go through.
We identified his specific triggers for atrial fibrillation. We also talked about ways that we could think about approaching a catheter ablation in a different way with the vest to non-invasively target regions that maybe previously had not been targeted in his earlier procedure. We went directly to an area that the vest had suggested was driving his atrial fibrillation. And within the first areas of mapping and ablating that region, within the first minutes of ablating that region, his AFib stopped. And it was really a beautiful thing to see.
Once you get back into a regular heartbeat for a period of time, my walks got to be longer. I'm off the meds, which meant I had more energy. You tend to do more things. We love to go camping, we love to go canoeing, we love the outdoors.
Please don't suffer from AFib. Come see a doctor, come see a heart rhythm specialist. Let us tell you and teach you what those options are and work with you to try to restore the rhythm of your life and improve that quality of your life.
Once you get treated for the AFib, it'll change your life around.